Hey folks, we are going to get started. Thanks so much for joining us today. For those of you that don't know, my name is Mike Walker. I am the president of an organization called the Voluntary Benefit Shop. And what we do every day is work with consultants around the country to help them bring these life with long-term care solutions to their clients. If for some of you, maybe this is the first time on one of our monthly webinars. We do this pretty much every month, a different topic every month, all to do with long-term care or life with long-term care. Sometimes it's legislative updates. Sometimes it's just an interesting kind of topic from the long-term care topic in general. And this session is being recorded, so you guys will have the opportunity to access it after the fact. You can just go to our website and find it, as well as the archives of any of the past webinars. So with that said, we'll get started. Feel free to enter questions into chat as we work through today's presentation, and we'll get to those questions as we can. And at the end, we'll probably also allow you to unmute and ask questions if anyone has questions as well. So with that said, we are going to get started with today's presentation. So again, a little bit of background on us. As I said, we work with organizations and agencies throughout the country. One very specific niche for us, it's these life with long-term care products, and we have developed a process that allows us to bring these to organizations in a very comfortable yet effective fashion. And if you want to reach out to that, my contact information is here if you want to talk more about that at a later time. And with that, today's topic is why are more municipalities adding life with long-term care or adding long-term care to the benefit strategy? And so there's a lot of background that goes into that. Some of it is just about general need, right? So we'll just touch on a couple of general need things. Maybe most of you know this, but 70% of us after the age of 65 will need, long-term care services. And it is an expensive proposition, right? If you're not familiar, here's a snapshot of what long-term care services cost in today's world. $80,000 for in-home care. Nursing home care can be in the $130,000 annually range. And the estimated cost of care for the final 5 years of life for a person with dementia is about $367,000. So folks, these are obviously big costs. Think about your clients. For most of your clients and their employees, these are costs that they're not prepared to deal with. And certainly when you think about the public sector, that's probably as true or maybe even more true than in the private sector, for sure. And then the other thing that many people just aren't aware of, I'm sure you all are aware of this, but many people as part of the general population are not aware of, is just, how long-term care services are or are not covered by things like, health insurance, Medicare, and Medicaid. I think all of us on this call knows that, health insurance, doesn't really provide any coverage for long-term care. Medicaid or Medicare has some very limited coverage in certain instances, but only for 100 days. And Medicaid doesn't really kick in until someone has exhausted the majority of their savings and assets. So certainly those in the public sector are just as vulnerable to this lack of knowledge and information as many of the rest of the people in the private sector. So let's get to the topic at hand more directly. So the public sector challenge, right? Like public sector employers face a challenge that has been an ongoing challenge, right? And it's the challenge of attracting good employees and being an attractive employer when competing with private sector opportunities. And public sector, they have in general have tried to have robust benefit packages and tried to have innovative benefit packages in some ways. And so they're currently or always, I should say, evaluating their benefit packages for effectiveness in that manner. And really, if you look at any of the studies about public sector and benefit plan evolution, one of the things that public sector, or some of the things that public sector employers are really focused on are holistic well-being, flexibility, and financial security. And certainly, long-term care as a topic, long-term care as a coverage definitely plays into that in a couple of ways, certainly like overall well-being and certainly financial security. And we'll touch a little bit more about that as we go. And, according to the International City and County Management Association, which is an association of public sector employers. The historical appeal of public sector employment has really been based upon the 6 things that you see on the screen here. Stability, security. Certainly there's less layoffs there, less insecurity in terms of overall employment, comprehensive benefits, right? And so those top 2 things, of course, long-term care in general falls into, both of those top 2 things. It's going to provide people with more long-term security in terms of their financial well-being. And it's also just part of a comprehensive benefit package. So I think when you look at the historical appeal of public sector employment, it's very easy to see how long-term care insurance is going to fit right in with that. And I think that's one of the reasons why we're seeing just a huge uptick in public sector employers that are looking at, long-term care in general, life of long-term care specifically with us as an employee benefit. And we'll talk a little bit more about that here as we go. Now, when you, according to WEX, the top new benefits in the public sector among public sector employers are listed here: enhanced mental and health and wellness, family and caregiver support, financial wellness and security, work-life balance and flexibility, and professional development. Well, certainly, long-term care insurance, life of long-term care insurance can fall into a couple of those categories. Certainly some family and caregiver support, potentially there could be some overlap there. And then just again, overall financial wellness and security. And so I think when you think about, public sector employers really trying to achieve, these 5 things, long-term care insurance, life with long-term care insurance is a very obvious, addition to benefit packages. And then you factor in the sandwich generation. And I bring this up because in the public sector, what we have seen, and we work with a lot of public sector clients, a lot of municipal clients, county governments, city governments, town governments, and that type of thing. And we see just a higher proportion of sandwich generation employees, people that are primarily in their 40s to 60s, in that group than in the private sector. And I think because of that, you have even more, need or desire for this type of product. Because if you think about the people that are in that sandwich generation, presumably all know this, but that group is facing the stress of, in many instances, still caring for children, while at the same time dealing with the real possibility or even current reality of also having to deal with their parents. And their parents, in many instances, maybe were not well educated about the need for long-term care insurance. In many instances, don't have long-term care insurance. And because of that, that sandwich generation is seeing the impact that long-term care needs are having on their parents' asset base, and also probably more importantly, or just as importantly, having on the sandwich generation themselves in terms of caregiving responsibilities, and in some instances, financial responsibilities for those parents that are now dealing with long-term care scenarios. And so because of that, and we hear this over and over again with dealing with all organizations, but certainly specifically in municipal organizations, we hear about the fact that, I didn't realize I was going to have to deal with this with my parents. I want to make sure that my children don't have to deal with the same reality with, in my situation. And so because of that, you have an even growing or an ever growing desire and need for education about how they can prepare for long-term care possibilities and for these types of products that we offer. So, couple of interesting stats here about what percentage of municipalities offer long-term care insurance as an employee benefit. So a couple different studies out there, but usually it's about 25 to 30% of current municipalities or municipalities currently offer long-term care or a life of long-term care option. However, 60% of public sector employers view long-term care insurance as a key financial wellness tool. And 66% of public sector employers are considering adding or evaluating long-term care insurance as an employee benefit. Now, we work again with consultants all over the country, and some of the consultants that we work with have a really big focus on, municipal business, public sector business in general, and so we see a ton of requests for this benefit within that part of the marketplace. In fact, currently we're enrolling uh, probably 7 to 10 county governments throughout the country that are currently enrolling at this time period, several school districts, and even more that are coming in, with quotes right now. So we see a ton of requests for this coming in, over time, and I think it's just increasing to pick up pace as time goes on. Now, these long-term care and life with long-term care and general policies are popular benefits among the public sector. And there's a number of reasons. And some of these are the same reasons that they're going to be popular within the private sector as well. But people like the nature of the hybrid product, right? They like the fact that it's going to pay a life insurance benefit and or a long-term care benefit, and in many instances, both benefits. So people are, paying for something that, they know is going to pay a benefit. Oftentimes, and more times than not, these are offered as voluntary benefits, and oftentimes without a high participation requirement, right? So that makes it easy for a municipal organization to be able to bring it to their, workforce without having to worry about, are they going to get 20% participation or whatever number the carrier were to throw out there, and still be able to take advantage of the guaranteed issue provisions that these products offer. And then some of the carriers and some of the services out there provide some elder care type of concierge services or just long-term care educational resources that are out there to help people as they have to deal with this. So while they can't necessarily buy an insurance product that's going to help them with their situation with providing care for their parents, they can oftentimes have some services that can provide resources to help them as they try to navigate that care dilemma and long-term care dilemma for their parents. And so that's becoming increasingly popular, increasingly requested. We're actually going through a big due diligence process right now for some of those concierge services for elder care that we'll be adding to our clients' availability over the next few months. So definitely that's something that has been really, really popular and has gained a lot of traction over the last few years. And then, of course, we talked about the guaranteed issue and just overall enhanced coverage flexibility. The fact that, with these life with long-term care options, people do have the ability to choose a lot of different levels of coverage and be able to choose something that can really fit into, their budget. And so what we see for this now is we see very broad appeal across the demographics of a workforce, and specifically in that public sector employment. It's not just the higher income earners. We see a lot of participation in this across the workforce. So another thing that comes up with public sector employers is, many of them have pensions that they provide to their workers. And so oftentimes a public sector employer will look at long-term care, and we have seen this as a way to help their employees protect their pensions, right? And part of the dilemma there is that, people oftentimes assume that maybe Medicare and or Medicaid is going to be a solution for them for long-term care. And maybe that's because they've seen it with, family members. Now, certainly, I think we all understand the limitations when it comes to Medicare. Medicaid, on the other hand, as I'm sure most of you know, only kicks in if someone has really, depleted their asset base down to a very minimal level. In most states, certainly less than $5,000, and in many states, $2,500 worth of, assets remaining before Medicaid would kick in. So if someone has a pension plan, they are in general terms never able to get below, or very rarely able to get below that, Medicaid, asset base or countable income base that would allow somebody to qualify for Medicaid. The current countable income base is just under $3,000, monthly. So typically, if someone has a pension, they're not going to be able to get, below that base, which prevents them from, being, covered by Medicaid. And what what many times what we often hear about is that, organizations, municipalities want to help, educate their workforce about this fact. And they want to help educate them on how to protect that pension. And so the, long-term care programs can help protect that pension by offering them programs that they can use to help pay for those long-term care services. So it helps prevent, all the things you see on here. It's going to help prevent asset depletion, protect spousal income. Of course, it's going to cover, pay benefits for non-skilled care. Most of these, life with long-term care options are indemnity products. So they're going to pay an indemnity benefit that someone is going to receive, whether, they have certified care, professional care, or whether their spouse is their primary caregiver, or they have some other non-skilled caregiver providing care. Again, the hybrid solutions where it is, both life and long-term care all combined into one benefit, which provides that kind of bucket of benefit that someone can receive, whether they do need long-term care, or even if they never need long-term care, it's still going to pay the death benefit. And some of the programs do have, tax benefits. Some of them are qualified long-term care programs that have the general tax benefits that those types of programs have. Now, some are not, tax qualified either. So there are, different ways to address it. But these are some of the big reasons why, municipal organizations, public sector organizations are bringing in these types of programs, and some of the ways that they do help people protect assets and certainly protect their pensions as time goes on as well. Let me share a couple of case studies with you for some of the organizations that we deal with. So this is a 1,000-person municipal organization, a county government. And so at this county government, out of the 1,000 employees, about 250 enrolled with life with long-term care. That generated about $301,000 worth of annual premium and about $120,000 worth of first-year comp for their broker partner. Now, here's a 550 employee municipality. Okay, this is a smaller city. Or actually, this was a county government. This was a county government actually in North Carolina. Out of the small county government, out of the 550, 81 enrolled. It generated about $61,000 worth of premium and about $24,000 worth of comp to the consultant that we worked with on it. And then this is a larger one. This is a 6,000-person school system. Okay, so large school system, relatively large school system. Out of those 6,000, out of those 6,000, about a little over 1,000 enrolled, generating about 1.3 million in annual premium and about $530,000 worth of comp to our broker partner. And then lastly, this is a 420-person small city government. Out of the 420, about 94 enrolled, generating about $114,000 worth of annual premium and $45,000 worth of comp to our broker partner. So you can see some of the examples. So you can see, like, we generally tend to get pretty good participation in the municipal, workforce, and you can see the type of results that we generally get. Now, if you're not familiar with these life with long-term care options, let me give you just kind of a quick snapshot here of how they work. Top left-hand corner, the plans all have a death benefit, right? And it's going to work just like you would expect life insurance to work. If you have these plans and you pass away, it's just going to pay your family the death benefit just like you would expect. Top right-hand corner, there's a terminal illness component. If I'm diagnosed with a terminal illness, it's going to pay me 75% of my death benefit right away. The remaining 25% is paid to my beneficiary when they pass. The bottom right-hand corner, this is my long-term care. This is where this comes into play. If I'm in a long-term care situation, whether I'm in a facility, whether I'm in my own home, it doesn't matter. It's going to pay me 4% of my death benefit per month for up to 25 months of receiving long-term care. After 25 months is ended, it doesn't end the coverage. It triggers my extension of benefits, which would then extend my long-term care benefit for an additional 25 months. So I would have a total of 50 months of long-term care payments in that scenario. And then even if I pass away during that or at the end of that, it'll still pay my family my full death benefit. So my death benefit does not reduce because I have the long-term care. My death benefit, or because I utilize the long-term care, I should say, my death benefit always stays whole. Now, the trigger for long-term care benefits you see at the bottom here, it is the inability to perform 2 or more of the 6 activities of daily living or severe cognitive impairment, which could be like Alzheimer's or dementia or anything of that nature. So 2 of 6 or severe cognitive impairment, that's what's going to provide or that's what's going to trigger the long-term care benefit. Now, I know it's a little tough to follow those percentages, so let me give you a real numbers example here of how this would work. Let's say that I had a $100,000 policy, and let's say I pass away. Maybe I've had a heart attack or I have an accident or whatever the case may be. It's just going to pay my family that $100,000, just like you would expect life insurance to work. Top right-hand corner, let's say I'm diagnosed with a terminal illness. It's going to pay me $75,000 right away, with the remaining $25,000 paid to my beneficiary when I pass. And then at the bottom, long-term care, it's going to give me 4%, or in this case, $4,000 per month for up to 25 months. After 25 months, it's going to extend it $4,000 a month for a second 25-month time period. And then even if I pass away during that or at the end of that, it'll still pay my family my full death benefit, which in this case would be $100,000. So you can see in a worst case care scenario where I have a $100,000 policy, and you use 50 months of long-term care and then pass, my family will have received $200,000 of long-term care benefits, along with a $100,000 death benefit, for total benefits paid of $300,000 on my $100,000 whole life plan. Okay, so and again, some people are thinking, hey, $4,000 a month isn't enough. Well, this is just an example. If someone did a $200,000 death benefit, of course, they would get $8,000 a month in long-term care, et cetera, et cetera. Okay. Now, I know we're running up on time here, so just to wrap up, a big part of having any successful Life with LTC, event, enrollment, whether it's in the public sector, municipal sector, private sector, it doesn't matter, is the employee engagement process. Again, we provide an unmatched employee engagement campaign that is very robust and diverse. We're big believers that people get their education in a lot of different ways in today's world. Some folks will sit through a 30-minute webinar. Other folks have to get a 45-second commercial, and somebody else wants to jump on the treadmill and listen to a 5-minute podcast, while another person wants to actually talk to a real person and schedule with the call center. So we provide all of that, video content, email content, live and recorded webinars, the podcast, access to our call center, digital resources, etc. And you can see this is kind of an example of what some of the content looks like. It's all designed to kind of take people to the next step. Click here to schedule a call, click here to learn more, click here to enroll or waive. And then there's a whole series of animated videos that they get. That's kind of like module learning. Like, this is the first module. What is long-term care? It's a 45-second animated video on what long-term care is. And then there's a whole series of these, as you can see. Some of them are, demographically specific, like why millennials and Gen Zs are choosing life with long-term care, or why the sandwich generation is choosing life with long-term care. There's a whole series of them. So anyway, that's how the engagement process works. Chelsea, do we have any questions in chat?
We do not have any questions in the chat as of yet.
Would anyone like to enter a question into chat or unmute to ask a question? Anyone at all? Okay, folks, we appreciate it. I'll give you a couple of promos for some upcoming webinars next month. On April the 16th, we have a webinar on designing life with long-term care benefits, employer paid and executive carve-out approaches. Okay, that's next month's webinar. We'll talk to you a little bit about what we do there. And then just lastly, if you want to learn how to, create life with long-term care opportunities from your client base or for your agency, if you're not already working with us, reach out to us here. Here's my contact information. This is what we do every day, is help organizations like yours create a life with long-term care sales pipeline. We hear the same thing when we talk to organizations all the time. They know that long-term care is a huge need. They know that it's a huge opportunity. They know there's income and revenue to be made. But what most organizations don't have is a clear process to create a life with LTC sales pipeline, introduce it, and then execute on that pipeline. That's what we bring to the equation, a very proven process to build a meaningful life with LTC sales pipeline. We help you execute on that sales pipeline. And then ultimately, we provide an unmatched employee engagement and education campaign that delivers results that are 5 times greater than industry average. And you saw a little bit about how those results look today, specifically in the municipal market. So with that said, I will stop there. I'll pause and see if anybody has any last minute questions before we let you go. Any last minute questions, folks? Thanks, Jeff, for the acknowledgement. Appreciate everyone. Thanks so much. We really appreciate your time today, and I hope you have a great rest of your day.